What ethical dilemmas does BDD pose for plastic surgeons? Imagine wanting to change a part of your body, but feeling convinced it's the source of all your problems, even if others see you differently. That's often the reality for patients with body dysmorphic disorder, or BDD. This condition causes a distorted view of one's appearance, making it hard to see oneself objectively. For plastic surgeons, this creates a complex web of ethical questions. One of the biggest issues is assessing whether the patient truly understands what surgery can and cannot do. Patients with BDD often have impaired insight into their condition, which means they might not realize that surgery might not solve their underlying mental health issues. When a patient cannot make a fully informed and rational decision, the surgeon faces a dilemma. Should they proceed or refuse surgery? Respecting patient autonomy is important, but if a patient's judgment is clouded, their consent might not be genuinely voluntary or informed. Another major concern is the risk of harm. Surgery rarely alleviates BDD symptoms and often makes them worse. Many patients remain dissatisfied after procedures, obsessing over perceived flaws that others see as minor or non-existent. This dissatisfaction can lead to repeated surgeries, psychological distress, or even aggressive behavior toward the surgeon. Performing surgery in such cases could violate the principle of doing no harm, because the procedure might worsen the patient's mental health rather than improve it. Surgeons also have to consider their own safety and legal risks. There have been reports of patients with BDD threatening or even attacking surgeons due to dissatisfaction. Some have filed lawsuits claiming they couldn't give proper consent because of their psychiatric condition. These situations highlight the importance of careful patient screening and the need for mental health assessments before surgery. Balancing the potential benefits and harms involves weighing whether surgery will genuinely help the patient or simply feed into their distorted desires. Often, surgery does not address the root causes of BDD and can lead to more suffering. Ethical practice suggests that surgeons should refer these patients for psychiatric evaluation and treatment first. Managing the mental health aspect is crucial, as surgery alone cannot fix the underlying disorder. In the end, plastic surgeons must navigate these ethical waters carefully. They need to respect patient rights while protecting them from harm, which sometimes means declining to operate. This approach aligns with the principles of beneficence and non-maleficence, doing good and avoiding harm. It's also vital to consider fairness and resource allocation, ensuring that surgical interventions are reserved for cases where they can truly benefit the patient. So, when it comes to patients with body dysmorphic disorder, ethical practice involves thorough assessment, collaboration with mental health professionals, and sometimes saying no to surgery. It's about prioritizing the patient's overall well-being and making decisions rooted in medical truth and compassion. Always remember, the best outcomes come from a holistic approach that treats the person, not just their appearance.